Did you know that cancer is one of the leading causes of death worldwide, claiming nearly 10 million lives annually, according to the World Health Organization? The good news is that up to 30% of these cases could be prevented with early diagnosis. Today, we will reveal the 7 most common early signs of cancer that you need to know. Identifying these signs could be the first step in saving your life or that of a loved one. Like this video, subscribe to the channel, and share it with anyone who needs this vital information. Together, we can fight cancer with prevention and knowledge. Are you ready to begin? Skin changes and unusual spots. Some changes in your skin may seem harmless, but can actually be important warning signs from your body. Moles or spots that appear suddenly, grow quickly, change color or shape, or wounds that don't heal for weeks might indicate skin cancer, such as melanoma, one of the most aggressive types. A practical way to identify something suspicious is by remembering the ABCD rule. Asymmetry. One half of the mole is different from the other. Borders. Irregular or poorly defined edges. Color. Multiple shades like black, brown, red, or white. Diameter. Larger than 6 millimeters, roughly the size of a pencil eraser. Evolution. Noticeable changes in size, color, or shape over time. These signs require immediate attention, as melanoma can spread rapidly. The good news is that, when detected early, the chances of cure are as high as 90%. Stay vigilant about changes in your skin and consult a dermatologist if you notice anything unusual. Early detection can save your life. Rapid and unexplained weight loss. Losing weight without effort might sound like a dream for some, but in reality, it's a symptom that should be taken very seriously. When the body starts shedding pounds rapidly without changes in diet or activity levels, it could indicate an underlying issue, possibly cancer. Experts consider a loss of more than 5% of body weight in less than 6 months, without any apparent explanation, to be a warning sign. This symptom is more common in cancers of the pancreas, esophagus, stomach, or lungs, as these diseases can interfere with metabolism or hinder nutrient absorption. Why does this happen? Cancer cells consume a significant amount of energy to grow and multiply, leading to a loss of muscle mass and body fat. Additionally, some tumors release substances that accelerate metabolism, intensifying the weight loss process. What should you do? If you or someone close notices significant weight loss without an apparent cause, it's crucial to consult a doctor for a detailed evaluation. Early diagnosis can make all the difference. Persistent cough or hoarseness. A cough that lasts for weeks without improvement could be more than just an irritation. This is one of the early signs associated with lung cancer, especially when accompanied by other symptoms such as chest pain, shortness of breath, or blood in the sputum. The persistent cough can be dry or productive, with its intensity varying from person to person. However, if it lasts for more than 3 weeks, it's essential to investigate. Similarly, persistent hoarseness may be an early sign of laryngeal or thyroid cancer, particularly if it isn't linked to a respiratory infection. Why does this happen? In lung cancer, coughing is often caused by irritation of the airways due to the presence of a tumor. Hoarseness may occur when a tumor presses against or affects the vocal cords or surrounding nerves. What should you do? If you experience persistent coughing or hoarseness, consult a doctor, especially if you are a smoker or have a family history of cancer. Simple tests like X-rays or endoscopies can help rule out serious issues or initiate appropriate treatment as early as possible. Lumps or nodules on the body. Feeling a lump or nodule in any part of the body is always a sign that deserves attention. While not all lumps are malignant, they can be one of the first indicators of cancer, especially in areas like the breast, neck, armpits, testicles, or abdomen. For instance, in breast cancer, many women, and even men, detect the issue upon noticing a hard, painless lump. Nodules in the neck could be linked to lymphomas or thyroid cancer. In the testicles, a lump may indicate testicular cancer. How to identify it? Check if the nodule is hard, fixed, and does not disappear over time. If the lump grows rapidly or causes pain, seek medical attention immediately. Why does this happen? Cancerous nodules usually form due to the uncontrolled growth of abnormal cells. These lumps can appear in any tissue of the body and, in some cases, press against organs or blood vessels, causing other symptoms. What to do? If you notice any lumps, consult a doctor for clinical or imaging tests, such as an ultrasound or biopsy. Detecting the issue early significantly increases the chances of effective treatment and recovery. Changes in bowel or urinary habits. Persistent changes in bowel or urinary habits are often overlooked but can indicate cancers like colorectal, bladder, or prostate cancer. What to watch for? Blood in the stool could indicate colorectal cancer, especially when accompanied by changes in the frequency or consistency of bowel movements. Changes in bowel habits. Frequent episodes of diarrhea, constipation, or a sensation of incomplete evacuation lasting weeks. Blood in urine may be linked to bladder or prostate cancer. Difficulty urinating. Interrupted flow or urgency could signal prostate cancer. Why does this happen? Tumors in these organs can interfere with the digestive or urinary systems, causing irritation, obstructions, or bleeding. What to do? If you notice blood in your stool or urine or experience bowel habit changes lasting more than 2 weeks, consult a doctor immediately. Tests such as colonoscopies, ultrasounds, or lab analyses are typically sufficient to investigate the cause and start treatment. Remember, the earlier these changes are evaluated, the greater the chance of identifying problems early and treating them effectively. Chronic fatigue and unexplained pain. Feeling constantly tired, even after a good night's sleep, or experiencing frequent pain without an apparent cause, can be one of the early signs of cancer. Although these symptoms can be related to various conditions, they should not be ignored, especially if persistent and intense. Why does this happen? Chronic fatigue. In some types of cancer, such as leukemia or lymphoma, the body uses a lot of energy to fight the disease, leading to extreme exhaustion. Additionally, tumors can release chemicals that alter metabolism, causing fatigue. Unexplained pain. Growing tumors may press on nerves, bones, or internal organs, causing discomfort or constant pain. Cancers such as those of the bones, pancreas, and stomach are often associated with this symptom. What to watch for? Fatigue that doesn't improve with rest. Persistent pain in specific areas, especially if not related to injury or physical exertion. What to do? If extreme fatigue or pain persists for more than a few weeks, seek medical help. A thorough examination can identify possible causes and ensure you receive the correct treatment. Fatigue and pain are symptoms many people ignore, but they can be a warning that your body is trying to communicate something serious. Listen to your body. Persistent fever or frequent infections. Occasionally having a fever is normal, especially when dealing with minor infections. However, fevers lasting several weeks without explanation can be a warning sign. This symptom is often associated with cancer such as leukemia or other types that affect the immune system, as the body struggles to fight abnormal cells. What to watch for? Recurring or persistent fevers, especially those over 38 degrees Celsius, without an identifiable cause, such as colds or visible infections. Frequent infections, or those that are difficult to treat. Why does this happen? Cancer can compromise the immune system, making the body more vulnerable to infections. In leukemia, for example, the disordered production of blood cells directly affects the body's defenses. What to do? If you notice persistent fevers or repeated infections, seek medical attention for a detailed evaluation. Simple blood tests, such as a complete blood count, can help identify critical abnormalities. Detecting these conditions early can make a significant difference in starting treatment promptly. These symptoms could be your body asking for help. What can you do today to take control of your health? Regular check UPS. Preventive exams are essential for detecting problems before they progress. Pay attention to your body. Any persistent, unexplained change deserves attention. Adopt a healthy lifestyle. Exercising and avoiding habits like smoking significantly reduce risks. Prioritize nutrition. Diet can be one of your greatest allies in cancer prevention. Did you know that some foods can strengthen your body and help fight inflammation, reducing the risk of many diseases? In the next video, we'll cover the 5 best foods to include in your daily diet and how they can transform your health. Stay tuned for tips that can make a difference in your well-being.